Universal health coverage is a cornerstone of our transformation agenda and a matter that touches every Kenyan family. Despite health being a devolved function, we acknowledge the immense financial burden that comes with health. Counties have struggled with shortages of medicine, equipment, sometimes staff, hindering service delivery and leaving countless Kenyans with suboptimal access to health care. It would have been easy for me to step back and leave this responsibility to counties alone. But that would have been a disservice to Kenyans and a betrayal to our Constitution. Instead of engaging in debates about healthcare being devolved, I have chosen the hardest but necessary path of addressing this challenge head on. Health delivery is not just about fulfilling a constitutional mandate by whatever level of government. It is about ensuring that healthcare is not a privilege for the few who can afford and a pipe dream for the many who cannot. For years, NHIF was saddled with debts and inefficiencies, and healthcare was being severely and negatively impacted. For far too long, too many households have lived on the edge, just one illness away from financial catastrophe. Our healthcare system has historically neglected the poor and vulnerable, leaving them without any option, while private sector medical covers remained out of reach for the majority. This is precisely what we will correct through the provision of universal health coverage. This agenda is not just about a promise. It is about a bold commitment to deliver health through transformative financing reforms, making healthcare accessible and affordable, digitizing our healthcare services to enhance efficiency, eliminate fraud, and stop corruption, and to empower a skilled and motivated health workforce. To honor our commitment on the universal health coverage, I signed into law 4 groundbreaking legislation on the 19th of October, passed by this August House. The Social Health Insurance Act replaced the outdated National Hospital Insurance Fund and established the Social Health Authority, which oversees 3 essential funds. This modern framework ensures that every Kenyan, especially the most vulnerable, can access quality healthcare services when they need it most. The shift from the National Health Insurance Fund model to Taifa Care is fundamental and radical in both scale and character. NHIF, if I give you a bit of example, NHIF served a few salaried Kenyans and those who could afford to pay. But Taifa Care covers every Kenyan, regardless of employment or financial status. Secondly, despite serving a limited class of citizens, NHIF nevertheless accumulated billions of shillings of debt because of misalignment between contributions and the actual cost of healthcare. Taifa Care has undertaken an accurate costing of all healthcare-related goods and services in order to provide timely, effective, and efficient service to every Kenyan that is affordable. Additionally, the NHIF had a waiting period lasting between registration and eligibility for service. I think it was like about 3 months. Under Taifa Care, citizens are eligible for all services upon registration. I therefore urge every Kenyan to take the most important step in securing dependable health care for themselves and their families. Register. Register now or at the earliest possible opportunity. Honorable members, for the first time in our nation's history, free primary health care is increasingly becoming available at dispensaries, health centers, and hospitals. Ambulance and emergency services are also slowly but surely being made available at no fee. Under Taifa Care, we have introduced a comprehensive benefits package that brings specialized care, such as cardiothoracic surgery, within reach for many Kenyans without the burden of financial strain. Through the Digital Health Act, we are revolutionizing healthcare delivery. Every step of the process, from registration, eligibility checks, to claims, is now digitized. By eliminating unnecessary human interaction, we are tackling corruption, reducing inefficiencies, and ensuring that resources are used where they are needed most. As a result, the good news, SHA will pay all October claims in full by next week. And it will continue like that going into the future. To date, over 15 million Kenyans have enrolled in Taifa Care, and more than 60% of employers have successfully transitioned into its framework. The newly established Social Health Insurance Fund empowers citizens to contribute towards accessing a broad range of healthcare benefits. This represents a seismic change from the old reactive healthcare model to a forward-looking system that prioritizes prevention and preparedness. Once the transition from NHIF is complete and SHIP becomes fully operational, Kenya will have a healthcare system that guarantees dignity, peace of mind, and equitable access for every citizen for the very first time in our 60 years of independence.